3 years ago, I did a ski-in expedition to the South Pole, and then last year I did a ski-in to the North Pole in 2014. And that was an exciting expedition. And the group I went into the North Pole had a group that was going to go back to the South Pole this year in January of 2017, and also climb Mount Vinson, which is 17,000 feet. And I was going to go on that trip, but during the training climb this past summer, I realized I just couldn't do it with the arthritis that I had in my knees. I postponed the trip for a year and was looking for a knee replacement, but not very excited about a full knee because the rehab takes so long, and people I've known had it aren't back to full mobility. So one of the people I went into the North Pole had gotten a full knee done by Dr. Stone, told me about the partial knee, so I contacted Dr. Stone and my surgeon in New Mexico. My surgeon in New Mexico is world-class and highly recommended Dr. Stone, so I came to see him. And we talked about the partial knee replacement, and it looked like the perfect thing for me. I was very interested in having a fast rehab because between now and a year from now, I need to be fit enough to climb 7,000 feet of vertical on ice, and I need to be able to ski 70 miles in at 10,000 feet and pull in a 100-pound sled. So I need to get fit fast. Surgery was 8 days ago. I had a partial knee replacement, medial on the right, and I have been walking since 2 hours after surgery. I have done 2-a-day physical therapies. I'm doing 2-a-day PTs, which I think is tremendously important to get ahead of the swelling and the pain. So starting with the day after surgery, a lot of it is manipulation, just the massaging and getting the swelling off and moving the kneecap and moving the legs so that it reduces the swelling and gets it off. So that makes it much more comfortable. The intensity and the continuation of it has been really effective for me. So whether you do PT with your facility or with on your own, you got to do 2 hours a day somehow, some way. I've had a really good experience with absolutely everything from the pre-op to the surgery to the post-op to the follow-up all the way through. The PT people have been fantastic. I've had calls and contacts 24 hours a day. I've had everything happen on this surgery has exceeded my expectations. I'm totally thrilled because I'm definitely on schedule again to do what I'm really hoping to do is get back to the South Pole a year from today.